Hi, everyone. This is Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we talk about Lyme disease. I look forward to seeing your questions tonight. It's always a little bit different, and sometimes you all stump me and challenge me in good ways. Sometimes I even get good ideas from you to try out with my patients too. So I look forward to seeing what we're going to be talking about here tonight. Anyhow, let's see here. I've got some messages saying, okay. I thought I was getting some messages saying people couldn't hear me, but I think you can hear me. Anyhow, so the way that these webinars work is you provide questions to me, all right? And the way you could do that is over on the right-hand side of the screen at the bottom. You write your questions to me in the chat box. The only thing I recommend is do not hit the enter key until the whole thing is done. Each time you click the enter key, if you're trying to create paragraphs by doing the enter key, it actually sends a separate question to me, and it gets extremely complicated for me to be able to follow, okay? The other thing that for those of you that are participating in the live version tonight, you're going to see that you'll be able to read the questions on your screen. I actually post them there, but they don't show up in the recorded version. And so what I will wind up doing for that reason, I will wind up reading the questions too, so that the people listening in on the recorded version can figure out what we're talking about. Okay. All right. So, one last order of business. Tomorrow morning, you will get an email from me announcing that the recording of tonight is ready. So yes, I am creating a recording as I do each week. That email will tell you that it is ready, and also will include a link to sign up for next week's webinar. Next week will be the last webinar in March. I'll be off from doing the webinars, at least, not from work, but from doing the webinars on the week after next week. Okay, so feel free to sign up for that. And the other thing I would encourage all of you to do is, if you're getting benefit from this, that means other people can get benefit from too. So please share the emails that I send out announcing the recording, as well as announcing the sign up for next week's webinar as well too. Appreciate if you'd help me reach as many people as possible, so I can keep meeting my mission to help as many people as possible with this crazy illness that we call Lyme disease. All right. So without any further ado, let's go ahead and get started here. Let's see here. Hello, Thomas. Let's see. Do you know the best way to recover or detox having been prescribed way too many psych medicines before they knew it was Lyme? It's created extreme agoraphobia, anxiety, panic attacks, and even a couple of psychosis events and seizures. So, Thomas, I guess I would need to know a little bit more about what you were specifically prescribed. So, for instance, things like benzodiazepines would be Klonopin, and things like Ativan, lorazepam, Valium. Those things take a while in some people to actually taper off of. And if you come off of them too fast, it could give you kind of situation like you're describing, okay? On the other hand, many of the other psych medicines, once you stop them, they are out of your system, and they don't require detoxing out. I would wonder if you have Lyme and you are having a lot of agoraphobia, anxiety, panic attacks. I would wonder if it's either Lyme actually causing those, or one of the co-infections that we see in Lyme disease, which is called Bartonella. So as many of you know, whenever you get a tick gives you Lyme, it may transmit some other infections. And the one that is known for giving a lot of more extreme or difficult psychiatric problems is Bartonella, all right? So things that might make you think about Bartonella is if you have a lot of pain on the soles of the feet, if you have psychiatric issues or psychologic issues, having a lot of neuropathy, so numbness, tingling, or nerve pains like sharp shooting, stabbing, burning, piercing, electrical pain. Sometimes people with Bartonella have some periods of air hunger, just like you can have in babesia, but it also can occur in Bartonella as well too. Sometimes Bartonella leads to irritation and inflammation of the bladder lining. So people will have a feeling like they need to urinate frequently, and it's not a bladder infection, or they'll have a lot of pelvic pain, and again, it's not bladder infection, okay? There are, so anyhow, I would consider whether that could be what's going on as well too. Okay. All right. Good luck to you, Thomas. Hello, Gail. Let's see. Hi, Dr. Ross. Can you please explain the controversy surrounding the legitimacy of the diagnosis of chronic Lyme? I get that the IDSA thinks that if you treat with a few weeks of antibiotics and you're still sick, it's not because there is still bacteria in the body, but rather is due to the inflammatory process that bacteria caused, and also a possible autoimmune response of the body to the bacteria they believe is now gone. To play devil's advocate, why is this such a flawed theory? Are there any actual studies that have proven that there is still Lyme and co-infections in the body after one has treated with antibiotics? Or does ILADS just feel that the bacteria is still present due to clinical presentation they see in patients? If there are actual studies proving the existence of continued bacterial infection post-treatment, could you please reference those studies? Thank you. So Gail, there are actually studies, and I don't have the reference list handy in this very moment to show you, but there are one place that you might want to look that I can point out to you right now that you could go looking for it is Brian Fallon, who is a researcher at neurologist researcher who also treats Lyme disease at Columbia University, has a book out about Lyme disease. I think it's called Conquering the Divide. You can find that on Amazon. And in there, he does reference some studies that show that Lyme does persist, okay? And these are, one of the ways that we can tell Lyme persist are basically animal feeding studies, I guess is what I would look at, is where you take like a mouse, for instance, or as an instance that you've treated, and then you have ticks feed on it, and then those ticks go and bite another thing, and like another mouse, and then suddenly that other mouse has Lyme. So that's one way it can be shown. There are also human studies that have done a similar way of doing it. They're called I forget the actual name of the studies. They're called some kind of studies where you actually you take somebody that's supposed to be cured, you have a vector feed on them, and then that vector infects another organism. That's one way to do it. There are also studies done that show that have shown by PCR studies that the DNA of the germs is still there. There are some. I just don't have the actual references where I have looked at them before. They are one place. The other place you might want to look to see about finding the references would be at ilads.org. Within their guideline about how to treat Lyme, they do reference. There are references in there making the argument that Lyme does live on, with studies that show that Lyme is something that lives chronically in a person even after treatment. Okay, so take a look at those sources. All right. Good luck to you, Gail. Oh, that's not to say, the thing with chronic Lyme is we think there is ample science that does show that it does exist after treatment. I know the infectious disease doctors do not pay attention to that science. And in fact, in their last set of guidelines, didn't even reference any of it. But they, for some people with Lyme, it is possible that part of their ongoing symptoms is due to an immune system dysregulation created by having the germ in you. So that's not necessarily a wrong opinion. It's just that they think it's the only reason that people remain ill with chronic Lyme. And we think there are some studies that do show that it does live on. Okay. All right. Thanks for that question, Gail. Hello, Carol. Let's see. Hello from the East Coast, Dr. Ross. Hello. Let's see. Thank you for providing these webinars. My 23-year-old daughter had been treated for Lyme, Bartonella and babesia for 3 years, was on ABT and several supplements. She got married last May and pregnant soon after. Their daughter is due in May. She had stopped all her meds until able to see the OB and recently restarted azithromycin fish oil and N-acetylcysteine at the direction of her Lyme doctor. I have read the article on Lyme and pregnancy on your website. Would there be any precautions with BART and babesia and infections to the baby? Are there any blood tests or other treatments that should be done for the baby after birth? I thought I heard about cases of anemia in the babies at birth and need for transfusions with Lyme. Would you recommend antibiotics for the baby precautionary, and any details? Also, any info on whether breastfeeding could pass on the infections or if breast milk should be tested? Any references suggested would be appreciated. Okay, so what I have to tell you is the research database here is extremely slim and small, okay? What we do know is that if a woman has, there were studies done, well, actually there was a pregnancy registry kept out in the East Coast in the late 80s, early 90s, where women that had Lyme, and I assume from the way the study was done, that means active Lyme, were followed to see what would happen with their pregnancy. Those that received antibiotics during the pregnancy had a 0% transmission rate to the babies, and those that did not had a 50% transmission rate to the babies. The difficulty is no one has done a study to look at what about the woman who has been treated for Lyme and is well going into pregnancy. Is it possible that she's still harboring germs that might be transmitted to the baby? So we don't know in somebody that's healthy with their Lyme in pregnancy, do they actually transmit or not? Those studies just have not been done. Okay, but there is a possibility of it. Nor are there studies that prove transmission of Bartonella or transmission of babesia. Okay, now in my practice, I will work to possibly prevent Bartonella and babesia treatment if I've got a patient that has active Bartonella or active babesia. I am going to want to make sure that I'm putting them on something to treat that during pregnancy that will also be safe if it crosses the placenta. So for instance, you can use atovaquone, which is Mepron, during pregnancy, but I reserve it for active cases because I don't know if the risk is worth it for inactive cases because we don't have any proof it can be transmitted, okay? But it is possible to use Mepron during pregnancy. It is also, which is atovaquone. It's also possible in pregnancy that the azithromycin that your daughter is on would also prevent transmission of Bartonella. In more severe cases during pregnancy, if somebody has active Bartonella in pregnancy, you can actually use rifampin, but you have to weigh out the risk and benefit. So although you can get away probably with using these things, there still are risks involved with doing it, okay? So regarding the science, it's not that good. We don't have solid science on any of this. There is science that shows that Lyme can be found in the breast milk of breastfeeding mothers. We don't have any science that proves that trans is transmitted to the baby. And the reason, one of the reasons it may not be transmitted to the baby, even if it's in the breast milk, is that basically the acid of the stomach would destroy Lyme. There are anecdotal reports where people like Dr. Charles Ray Jones, who's one of the pediatricians that manages a lot of Lyme in this country, does have case reports where he does strongly believe that that there was transmission by breastfeeding. But again, we don't have any solid science showing that, okay? So in my practice, I have discussions with people. I definitely say to them that if they are having active Lyme, we probably should have them on one antibiotic during pregnancy, like azithromycin, like a ceftin, to prevent transmission. But more and more, I think the question is gray as to whether you treat somebody that doesn't have any symptoms at all. It's not clear that if you are asymptomatic that you transmit during pregnancy or not. It's just not. So I get into a discussion with my patients and let them have a choice in that. It should be an informed choice. I don't do presumptive treatment for Bartonella or babesia to prevent transmission unless, in my practice, unless I see that somebody has Bartonella symptoms or somebody has quite bad babesia symptoms. In that case, I will. Regarding breastfeeding, I give the patient the option that because it can be found in breast milk, I explain that it might be transmittable, but we don't have solid science that proves it is. And there are a few case reports that says it might be. And then I let the patient decide, do they want to take the risk or not? What I will wind up doing to prevent breast milk transmission is put them on antibiotics if they choose to. But again, I think we don't have solid science that shows it is, okay? And then finally, at birth, what I would do with the baby is to get you want to draw cord blood from the placenta, which is the baby, is on the baby side. The blood is coming from the baby side of the placenta when you draw it from the umbilical cord, okay? And you would want to have PCR testing done through IGeneX to see if there is Lyme in that blood. All right, now, I would not do antibody testing like an immunoblot or a Western blot for Lyme because the antibodies that cross over into the baby's side or that could be found on the baby's side of the placenta during pregnancy are ones that can cross over from the mother. So if you do a Western blot, which is an antibody test, or an immunoblot for Lyme, that's an antibody test. If it comes back positive, it may be because the mother's antibodies came across the placenta versus the PCR, if you draw it from the umbilical cord and you actually have PCR, which means you have the positive PCR, which means you have the DNA of the Lyme germ in you, that means it did cross over into the baby, okay? And that's the best we can do. The Western blot and immunoblot are not tests that are useful to do on the baby until the baby's about a year old. So anyhow, the issue still is you run into the issues of mother's antibodies being present in the newborn, okay? All right. So I hope that gives you some useful information. We just don't have great science here. It's just there isn't, okay? All right. Thank you. Good luck. Or thank you for that question, I should say. Hello, Susie. Thank you for continuing to offer these wonderful webinars. You're welcome. When treating Bartonella, do I work up slowly to 30 drops twice a day of sida, acuta, and hutania? Or is the sida dosage 1/4 teaspoon 3 times a day, and then after 1 week increase to 1/2 teaspoon 3 times a day? If the larger teaspoon amount rather than the drops, is there a way to purchase it in a larger quantity? You know, it's interesting. As many of you may be familiar, the way that I recommend herbally to treat Bartonella is to use the 2 herbs, sida, acuta, and hutania. And where I got the idea to use both of those herbs comes from Buhner, as in Buhner herbs. These are the 2 herbal antibiotics that he recommends for treating Bartonella. Now, Buhner recommended working up to the 1/2 teaspoon 3 times a day. That's where I originally got that dosing, and I think that still is reflected in my article. However, more and more, I've actually moved more towards working with my patients and using it as working up to 30 drops 2 times a day. And so I usually have them take it directly with the hutania. And the way that I have people start is at 5 drops twice a day, and then increase by 1 drop per dose per day, working up to 30 drops twice a day. And that I tell people that if they get worse as they increase, to stop increasing until that worsening has passed, okay? And what I can report to you is that when I use it as 30 drops twice a day, that is the sida, acuta, along with the hutania, I'm getting good results. I'm getting the same kind of results as I did when I used this higher dosage, the bigger bottle amount of the sida, acuta. And so I would save your resources. I would do the 30 drops twice a day. I'm finding that quite effective. Okay. All right. Thank you for that question. So everyone, let me just do a quick screen share here. Okay, so this is my Lyme disease information site. So it looks like we're going to have a theme of Bartonella tonight, just a little bit. So in terms of Bartonella, if you're ever wondering how do you do something, Many of you are familiar with this site, but this is my online Lyme guide, okay? So in terms of how to diagnose Bartonella, take a look at this article here. I talk about using the symptoms, although there is blood testing you can do too, okay? All right. And then in terms of how do you treat Bartonella, take a look at my infection treatment plan section here. And in here is my article on how to kill Bartonella. And I do believe, so down here I talk about various prescription and I do recommend herbal options. In terms of the herbal option, it is this sida, acuta, and hootenea. And you're right, I still in this article recommend it as a quarter teaspoon 3 times a day. Again, I've evolved on this. I'm starting to actually use it more as working up to 30 drops 2 times a day. Okay. All right. And in this article, everyone, I am starting to recommend using oregano oil to treat persister forms of Bartonella, while the sida, acuta, hootenea probably is better at treating growing forms. I will tell you that there's no studies that have been done trying to see if hootenea and sida, acuta work on persister forms. They might. Okay. All right. And then finally, if you're, I think that's good enough. All right, so let me go back here. All right, so this thing that I was mentioning called persister and growing forms, how we treat Bartonella has been evolving over this last year based on some new research that got published over a year ago by Dr. Ying Zhang in his lab at Johns Hopkins University. And we now know that Bartonella not only has growing forms of the germ, but his research was the first research to prove that Bartonella can have what are known as persister growth state of the germ. And what a persister is, it's a form of the germ that basically slows its metabolism way down, goes into hibernation, and basically ignores the standard antibiotics, okay? Now, Dr. Zhang has been doing quite a bit of research trying to figure out what works on these persister forms, and the regular antibiotics that we use to treat Bartonella do not. But no one has done studies to say whether sida, acuta, and hootenea treat persister forms. They may, I don't know, but because I've got a lot of people just using sida, acuta, and hootenea. But because we now know of persisters and there are herbal options to deal with persisters, I now use the sida, acuta, hootenea along with oregano oil at the same time, okay? Now, one thing about the oregano oil, I've been using a product at my store by Doctor Inspired Formulations. It's a liposomal oregano oil. I like the liposomal variety because it's got great absorption. Unfortunately, we're just about out, and that's because the manufacturer has lost its supplier, or the supplier that sends it the capsules isn't able to get them anymore. And it looks like it could be 2 months or longer. Okay. So for those of you that are doing it, you're going to quickly soon see a change in product at my store, which is going to be another product by Dr. Inspired Formulations, which is called Cinnomon, Oregano, and Clove liposomal oil. All right. And so I want to let you know it's a good product too. So the amount of oregano oil in this other product is the same as is in the current liposomal oregano oil product by Dr. Inspired Formulations. But in addition, they include clove and cinnamon, which are also shown to be beneficial in the Johns Hopkins Dr. Ying Zhang studies as well too. So in fact, it'd be interesting to see as I start working with it, whether I even get better results by including the oregano along with cinnamon and the clove oil that's coming in this new product. You'll see that I still have the liposomal oregano now, but in about another day or two, we will probably be out. And we will be, by tomorrow, I will have set up at the supplement store a new product page that you will be referred to. If you try to get the liposomal oregano oil, you'll be referred over to this new product page that is for the new product I was just telling you about. Okay? All right. All right. Thanks for that question, Sue. Good luck to you. Hello, Lynn. Hi, Dr. Ross. How long do you need to take supplements for mitochondrial repair to heal damage from Lyme or extended antibiotic treatment? Also, if Lyme was suppressing the immune system enough to make testing results show a false negative, would you expect to be having Lyme symptoms? Finally, should I stop LDN, which is low-dose naltrexone, and astragalus prior to getting the COVID vaccine due to their immune system activity? All right. Okay. These are all good questions. You're giving me some tough ones here. All right. So the first one. So everyone, so about the mitochondria repair. So mitochondria, everyone, are your cell energy factories. And there are around 300 to 400 per cell. They have an outer membrane on them that is made up of a double layer of fatty acids or a bilipid layer. When you have chronic infection like Lyme, the immune system overproduces oxidizing agents to help poison those germs. And those oxidizing agents can also lead to injury of the covering of the mitochondria, okay? Also, physical traumas to the body and emotional traumas sometimes can lead to injury of those mitochondrial membranes as well, too. So if I'm treating somebody for Lyme, and we're saying 6 months, 9 months into treatment, and their energy just is not budging, I'm often going to try to do some things to repair the mitochondria. And I usually try to do that repair work for a minimum up for 6 months. You try to do it for at least 2 months, and you see if they're getting better. If they are getting better, if they are getting better, then you get maximum improvement by treating for at least 6 months. And what I like to use as the two critical components to mitochondrial repair is to fix that covering. And that is, I like using a product which is called ATP 360 by Research Nutritionals. It has phospholipids in it that they've done some limited research that shows actually improved functioning of the mitochondria by using their formula, okay? In addition, so that kind of fixes the mitochondria from the outside. The thing that works on fixing your mitochondria from the inside is glutathione. Glutathione is an antioxidant that many of you know we use to support detox, but it actually is used within our cells and mitochondria to repair damage on the inside. And they're supposed to be able to make it on their own, although mitochondria don't make much glutathione. But if they're injured, they will keep trying to fix themselves and they'll exhaust their glutathione supply. So you also want to be on glutathione, and I prefer a liposomal product because liposomal glutathione is better absorbed. And the product I like is the Research Nutritionals product called Trifortify, because they also have done studies showing good absorption into red blood cells, which is what they studied to see, is it absorbed? And they have got some good studies showing really improved absorption, good absorption into your red blood cells, which would suggest you have good absorption into any cell then, basically, okay? And the way I like to use the Trifortify product is 1 teaspoon 1 time a day. Okay, that's the minimal thing to do the ATP 360 and to do the liposomal glutathione. All right, now, if you are a vegetarian and you're not having any red meat at all, or if you're a person that's a non-red meat eater, and red meat is lamb, buffalo, or beef, that's red meat, okay? If you're a non-red meat eater, that means you're probably going to have low levels of a chemical called carnitine. And carnitine is used as a transport vehicle in the covering of your mitochondria to carry fat to the inside, where fat is burned through chemical reactions along with sugar into the cell fuel, okay? So if you are vegetarian and not getting red meat of any kind, then you need to be on some carnitine too. And what I like using for that is a Thorne product called Carnitil. It's a well-absorbed product. And that's 500 milligrams I start people at twice a day. And then after a month, you can decrease it down to 1 time a day, okay? And for people with extreme fatigue, I will add one more thing, and that is coenzyme Q10, or also known as CoQ10, 400 milligrams twice a day. It actually is used to carry electrons around the various chemical reactions within your mitochondria, okay? All right, so there's 4 parts to doing mitochondrial repair. Okay, one other thing. If you are taking if you are on atovaquone, which is found in Mepron or in Malarone, then you do not want to take the ATP 360, because ATP360 also has some coenzyme Q10 in it. And you also don't want to take CoQ10 because CoQ10 interferes with the action of atovaquone. Okay. In that case, what you want to do for your lipid repair is to do NT factor. And that's another product by Research Nutritionals. It does not have CoQ10 in it. And you would start at 2 pills 3 times a day. You do that for 2 months. And then after 2 months, you decrease it to 1 pill 3 times a day. Okay. But you want to do that, give all of that at least a minimum of 2 months to see if it's going to make any difference. And if it is, then you continue for a total of being on it for a total of 6 months. Okay. All right. I know I've just said a lot. I've got it all written down. I'll show you the article that you can take a look at here in a minute. Okay. All right. All right. Second thing is, all right. So with is about having a negative test. Would that reflect a negative Lyme test? Would that mean you shouldn't have symptoms? Okay. So when we do Lyme testing with either an immunoblot or an ELISpot, we're looking to see is the immune system reacting against the germ. We're not actually measuring the germ. We're looking to see is the immune system reacting to the germ. Okay. And sometimes because of immune suppression, you're going to have normal ELISpots, or you're going to have normal Western blots, or you're going to have normal immunoblots. All right. Now, that doesn't mean you're going to have negative symptoms, because the germ could still be raging in you, and you still can have symptoms from that. Yeah, you still can. So anyhow, I hope that answered your question there. And then finally, should I stop low-dose naltrexone and astragalus prior to getting the COVID vaccine due to their immune system activity? So the only thing I'm having people stop are things that actually target and try to lower cytokines. Okay. All right. So what happens when you get the vaccine, and whether it's the Johnson & Johnson, whether it's the Moderna vaccine, or whether it is the Pfizer vaccine, all of those eventually cause the production of what is known as the spike protein on the coronavirus. Okay. And then the immune system sees that spike protein and sees it as a foreigner and reacts. And the chemicals that modulate that, trigger this immune system reaction, are cytokines. They're the messengers of the immune system trying to tell other parts of the immune system to turn on, to attack that foreigner, if you will. Okay. All right. And that foreign protein, if you will. Okay. So you do not want to interfere with cytokines. You want the cytokines to go. All right. All right. That means also when you get the COVID vaccine, people sometimes have increased cytokine symptoms. So it's not uncommon with all of these vaccines to have increased fatigue, increased body pain, increased brain fog. That's because the immune reaction that we want to have is to have increased cytokines to turn the immune system on. Okay. All right. Now, usually that's going to go away within a few days to even a week or so. All right. So it's not a permanent increase, but it does happen. All right. So low dose naltrexone is not interfering directly with cytokine production. Okay. Astragalus is not interfering with cytokine production either, but rather what it's doing is promoting effective or amping up the immune system. I don't think that it amps it up too much. So I'm not telling my patients to stop LDN or astragalus. What I am telling them to stop would be things like glutathione, because glutathione as an oxidizing agent limits oxidizing agent, is an antioxidant. Boy, I gotta get that straight. Glutathione is an antioxidant that lowers oxidizing agents that tell white blood cells to make cytokines. Okay, so you don't want to limit that. All right. You also don't want to be something that gets inside of the white blood cells and tells them not to make cytokines. So those things would be quercetin, curcumin, the product called Cytoquel has a number of things in it that do that. And then I would not be on Japanese knotweed. Now, knotweed's an interesting herb. It can be used to kill Lyme, but it also is anti-cytokine. So I wouldn't be on those. All right. And what I'm telling my patients to do regarding those is I suggest stopping them all for about a week before you get the vaccine, and then you can resume them 2 weeks after the vaccine. All right. The 2 weeks is we expect the full effect of that vaccine to occur at about 2 weeks out. Okay. So at that point, it's not going to matter if you're doing things to limit the cytokines at all or not. Okay. All right. So those are my thoughts on that. Let's see here. Let me just do a quick screen share here. Okay, so in terms of these points I made about mitochondria repair, take a look in my energy section right here. And here's my article on what you do to fix mitochondria. Okay, and in here, I believe I talk about the different products. Let me go back here again. Yeah, so I mentioned all three of them, the NT factor, the ATP 360. Some people are on ATP fuel, but my preference is to do the ATP 360 rather than the ATP fuel. If you want to see a comparison where I compare these three products, you could click on this link here where I talk more about the differences between ATP fuel, NT factor energy, and ATP 360. These are all made by research nutritionals, okay? And then in terms of the products, this is my supplement store. If you're ever wondering what I recommend to people, what supplement brands I like to use, what actual supplement products I like to use based on, I base it on what I see works in my patients, right? So I find these all to be effective here. But also, I've chosen brands that have a track record of picking good ingredients that are effective, and brands that don't include a lot of garbage fillers in their products that might hurt a person with Lyme, okay? So if you're looking at a good source to buy your supplements, take a look here, okay? So in terms of these research nutritionals products, so the one that, I'd recommend is either this ATP 360, okay, so this is one of the ones that I recommend, okay? Or the other one you can do for phospholipid repair is the NT factor if you cannot be on CoQ10, and that is this product right here, okay? All right. All right, let's go back here. All right, Lynn, thank you for that question. Good luck. Hello, Megan. Hi, Dr. Ross. In your patients with difficult to treat Lyme and Bartonella, which has been unresponsive to correct treatment approach and proper duration, how often is it that heavy metal toxicity could be impeding progress or is an obstacle to cure? In other words, have you seen that chelating the heavy metals can make it so that the antibiotics will be more effective because the immune and nervous systems are now freed up from that burden? 2, can you please explain how herd immunity can be reached when the virus is still transmissible in vaccinated individuals and not everyone will be getting the vaccine? All right. Trying to figure out how I want to respond to this. Okay, so first of all, Megan, regarding heavy metal toxicity. So heavy metal toxicity, if you have it, may hurt the ability of the immune system to get involved to help get rid of Bartonella, okay? But the other thing that heavy metal toxicity can do is worsen some of the neurologic symptoms that are attributed to Bartonella. So if somebody has heavy metal toxicity and some of their Bartonella symptoms over time, like numbness, like tremors, like cognitive dysfunction, are not getting better, it could be that it is not necessarily a Bartonella symptom, or Bartonella causing it, I should say. It may be that the heavy metals are actually giving you the neurologic impairment. Okay, so it could be that. In general, in my practice, I usually don't start looking for heavy metal toxicity in patients unless we try a lot of other things and nothing works. Then I'm going to start wondering about heavy metals. In the average person, what I have found when they have heavy metal elevations, that all the things I can do to get them better, in the average person near the beginning of treatment or still early in treatment, I usually don't find much benefit is to be gained by getting heavy metals out. All right. I usually find there's more benefit by being on antibiotics, being on ashwagandha, getting sleep, lowering cytokines. Those are the things that give the most benefit. And often, even if we find heavy metal elevations, we don't have to do anything about it because we take care of those other problems and they're back on their way. Okay. But in a person that we've done all the things we can to get their Bartonella under control, and yet they still have significant neurologic issues, I have found maybe 40 or 50% of people get benefit by chelating out those excessive heavy metals, because it could, again, be part of the cause of the neurologic dysfunction rather than Bartonella being the cause. And it would also allow the immune system to jump in and work more effectively. Okay, so those are, I guess, what I would say the odds are on that. In terms of herd immunity, so let me read. Okay, so in terms of herd immunity, you raise the issue of how do you reach it if people that are vaccinated are still transmitting it? And the answer is they probably don't transmit it. Okay, so let's talk about that. So at this point, so here's what the issue is. When you're vaccinated against COVID, you can still get the infection in your oropharynx, in your throat, and here. Okay. And there's an argument to be made that you might then become a source that can spread it to others rather than stopping the spread of it to others. Okay, so herd immunity would mean that we stop spreading it to others because we're vaccinated, others can't get it, and they therefore are protected. Okay, so what probably happens, but we don't have the research yet. The research supposedly is being done, and we'll probably show this, but probably what happens is that when you are vaccinated and you get a COVID exposure, some of those germs will start growing up here in your sinus passages and maybe back here in your throat, okay? But then your immune system moves in quickly and keeps the germ load from getting big enough to spread to others, okay? That's what the issue is. It isn't just that you have a few germs here or a small number. You have to have enough of a load so that when others come in contact, they breathe enough in to get infected, okay? And what we think is going to happen is by being vaccinated, that the immune system will be able to limit the germ load low enough that you are not a source that can actually infect other people, even though you may have the infection up here that your immune system is getting under control and protecting you from getting very sick, okay? All right. And actually, as I've looked at the limited science about that, I think that's probably what's going to wind up happening. They're still studying it within COVID-19 to see if that actually is true. Okay. All right. Thanks for that question, Megan. So Megan, let me say one thing. There was a while back, or there are these studies that have been, or there is a way of doing COVID testing, which is to measure their antigen test, all right, versus the way that most of us do our nose swabs right now is a PCR test. So the PCR nose test is looking to see if you have the genetic material of the germ in you, okay? Versus there's another way to do it, which is to see if you have the proteins of the germ. That's an antigen test that is in your snot or with a quick nose swab. The antigen tests are a quicker test. They're not as time intensive. Now, the antigen test basically could be useful because if you're detecting, the antigen test may miss low levels of virus, but the antigen test, if you have enough of the germ in you, you have higher amounts of antigen, the antigen test would be positive. And a number of these antigen tests that have been developed out there could be used by people before they go to like sporting events or go to concerts. And if you are positive on an antigen test, that means you probably are infective. And you could infect others, all right? But if you're negative on an antigen test, even if you happen to have been infected and you don't know it, if you're negative, it means you don't have enough of a germ load to actually spread it to others, okay? So there was a lot of talk early on within the pandemic that hopefully we would get these low-cost antigen tests that everyone would carry around with them and test themselves before they went into a public space. And if it was negative, we would know that they weren't going to be transmitting. It didn't mean they weren't infected, but they wouldn't be transmitting it, okay? So the reason I raised that is regarding the vaccine. The vaccine probably is going to keep people from being able to transmit because it will keep them from being able to get enough of a germ load that is transmissible, okay? All right, I hope that explains it. I hope that makes some sense. Thanks for the question. Hello, David. Let's see. Hi, Doc. I was diagnosed with Lyme, Bartonella, Borrelia, babesia early last year. For the past 2 years, I've had an inner elbow, upper chest pain, neck pain, on the left side of my body, small cherry blood blisters on the body, eye floaters, and fatigue. I've had many treatments with no success. Any thoughts on what bug is causing these symptoms? Any treatment recommendations? I'm 43, 184 pounds. Thank you. Let's see here. So let me read this again. So past 2 years, I've had inner elbow pain, upper chest pain, neck pain, all on the left side of my body. Small cherry blood blisters on the body, eye floaters, and fatigue. Okay. David, I wish it was simple as you just listing out what you just did there. I need to ask you more questions. I would just give you a couple observations. So those red cherry spots, if they are coming up, if they are newer spots, they probably mean either babesia or active Bartonella infection. They can mean that, okay? Now, if they are old ones and you were adequately treated for one of those before, sometimes they just don't go away. But if you're getting new ones, it could indicate either a Bartonella or a babesia infection. The fatigue is predominantly more of a babesia symptom, but sometimes happens in Bartonella too. And I really would need to do a lot more discussion with you to venture which infection is active in you and what you should do. Unfortunately, you could take a look if you want. I do have a whole consult service that you could consult with me so I can have a longer time to chat with you and visit with you to figure this out. I would suggest a 1 hour visit because I need to get a pretty detailed history from you. I do bill in 15-minute increments, so if we could do it in half an hour, that's all I would charge you for. But let me show you how you would find how to do that real quick. All right, so take a look at my clinic. Oop. There is my clinic. All right, this is my clinic website, which is martyrossmd.com, okay? And click on the appointments page. And I describe here what is my limited consult service visit, okay? Read down here to find exactly what does this entail, cost, the fact that insurance will not reimburse for it, etc. And look through this entire section because it will answer probably all the questions you have about it, okay? But if that interests you, then take a look at click on this Book Now button, which brings you to my appointments page where you can set that up, okay? All right. Good luck to you, David. Thank you. Hello, Robert. Say hi, Dr. Ross. Thanks for all your help. What are the anti-cytokine supplements you recommend discontinuing before receiving the COVID vaccine? How long after the vaccine should you wait before starting them again? Okay. Oops, let me get rid of that. So Robert, I think I did mention this earlier, but you want to stop your anti-cytokine herbs beginning a week before the vaccine. That's how I've been doing it, and then have people resume them about 2 weeks after. The reason for the 2 weeks after is it takes 2 weeks after the vaccine to get the full benefit of that vaccination. I don't want to do anything to block it, okay? The anti-cytokine herbs that I'm telling people to stop would be the product called Cytoquel, which is by Research Nutritionals, and in addition, quercetin, curcumin or turmeric, which curcumin is a component of turmeric, and glutathione. The other thing is Japanese knotweed, which I don't use as an anti-cytokine agent, but it can have anti-cytokine effect. I would not be on that one either. Okay? All right. Thanks for that question. Hello, Andrea. Let's see. Hello, Dr. Ross. I was diagnosed with Lyme and Bartonella in July of 2020. The reason I got tested was because in May of 2020, I received a cosmetic Botox treatment, and with a week of getting it, I got terribly sick. My doctor couldn't figure out what was wrong with me, so he did pretty much every test he could. I was a perfectly healthy person before this. Can Botox cause Lyme to come out of hiding? Is there any possible way the Lyme and co-infections could be in Botox since they use donated human plasma? Interesting question. I don't know. I don't know enough about how the serum is prepared. In theory, yeah, but I don't know. I would have to look and see how that's all processed. In terms of, have I seen people activate Lyme from getting Botox injection before? No, I have not seen that happen. And in fact, I tell my patients, and I have a number of people that actually get Botox injections during treatment, and I've never had it interfere with the treatment. So many of these people would be getting them for non-cosmetic reasons, like to help manage migraines, et cetera. But I do have some that get them as part, to do cosmetic management during the Lyme treatment as well, too. And I just haven't seen it get worse. I can't explain why that happened to you. All right. Good luck to you, Andrea. Hello, Catherine. Hello, Dr. Ross. Can I go straight to glutathione after long-term mold exposure, or do I have to use something to bind? Well, Catherine, the question is, does a long-term mold exposure actually cause you to actually have mold toxins trapped in you? All right. So let's talk about that real quick. So when you have mold exposures, there's actually two kind of general problems that might happen. Number one, you can develop environmental allergies to the mold spores and the mold in your environment, the actual living germs, okay? Or you can have allergies to the mold spores, all right? So that would be a situation where you get a lot of runny nose, you have a lot of extra histamine release, and that might give you brain fog, and you might feel tired from all those histamines running around too, okay? All right. But also then there is, in that kind of a situation, just getting out of the mold environment is the cure. You just got to get out of there. Get out of there. You're not going to have allergic reactions to it anymore. Okay. All right. The other thing that though can happen is when you're in an environment that has a lot of mold, some of those molds release toxins. 75% of people can be exposed and live in those mold toxins and never have a health problem. All right. So you can, I could go walk in a building full of black mold, and the way that I am designed, my body would deal with it. I would not have a health problem from it. Right. But 25% of people, when they are in an environment that has a lot of mold, will breathe in the mold toxins, and those mold toxins eventually get trapped in their bloodstream. And those mold toxins that are trapped in the bloodstream keep a person sick, okay? So let me describe the difference between the 75% and the 25%, okay? So in 75% of people, our immune system, when we breathe in a mold toxin in the world around us, some of our immune cells will tag those mold toxins that they see in the bloodstream, and other parts of the immune system will come in and break those mold toxins down. All right? They're done. They're not going to bother us, okay? Now, in the 25% of people, what happens is we believe there's a genetic programming error or a programming defect where the white blood cells are not programmed to recognize those mold toxins. So those mold toxins never get tagged, so they don't get broken down. So those mold toxins are stuck in your blood. And then what happens is they go to the liver. The liver is supposed to try to clean out what are known as fat-based toxins using chemicals like glutathione, but the liver doesn't do that well. In fact, so what it's supposed to do is use chemicals like glutathione to help transform those fat-based toxins like a mold toxin into a water-soluble or a water-based toxin. And if it were to do that, these water-based toxins, that mold water-based toxins, would then go out into the intestines, mix in our poop, and we'd poop them out, and they never bother us again. All right. The problem is, though, is that these mold toxins are not handled that well by the liver, and they come out of the liver still as a fat-based toxin. They're not transformed by the glutathione. They go out into the intestines, and they get reabsorbed back into your bloodstream. All right. And so these circulating mold toxins that are in you then trigger your immune system to manufacture a bunch of chemicals called cytokines. Many of you are familiar with that word cytokines because I talk about it about every week. So cytokines are chemicals made by your white blood cells that are good and bad. On the good side, white blood cells will make them when they see toxins, when they see infections, when they see the spike protein on the COVID virus from your immunization, spike protein that I should say the COVID virus spike protein from the immunization. They will see that as a foreigner and they'll make cytokines. The cytokines they make are good on the sense that they turn the immune system on, they draw white blood cells to where the problem is, and they help those white blood cells work better. That's all great, okay? But if the immune system is doing a rotten job dealing with the problem, it's going to try harder and harder, and eventually it's going to make too many cytokines. And too many cytokines make you hurt all over, give you brain fog, interfere with your hormone production, give you low energy, etc. Okay, disturb your sleep. All these things that we call Lyme symptoms or mold toxicity symptoms are actually excess cytokine symptoms. Okay, all right. So you have to see before you decide you're going to start trying to treat for mold toxicity. Just living in an environment with mold toxins in it doesn't mean you have a problem. You might be one of the 75% that can deal with it. Right? So the best way to see if you have a problem is to do a urine test to see if your kidneys are removing some of those excess mold toxins that are built up in you. Because your kidneys can remove some of them, but they're not an effective source of getting rid of all of them. Okay. So the two tests that the two labs I like to use are Real-Time Lab and Great Plains Lab. Those labs have a urine test. Okay. Now, there's another group of doctors out there. I call them the Shoemaker doctors that were trained by a physician named Richie Shoemaker, who's the first doctor that discovered mold toxicity. And Dr. Shoemaker has trained them not to trust these urine tests. All right. Dr. Shoemaker's way of figuring out if you have mold toxicity issues is to do the genetic profile to see if you have a genetic profile that might set you up for the problem. And then also to measure a bunch of inflammation chemicals in the blood and see if they're elevated, okay? Now, here's the problem with the Shoemaker approach. Having a genetic predisposition doesn't mean you develop the problem, okay? Genetics do not equal problems because our environment can sometimes correct for the genetic issues, okay? Right. Number two, if you happen to have a Lyme infection in you or Lyme and co-infections in you, the inflammation that they trigger is very similar to the inflammation and chemical marker changes that the Shoemaker protocol tests for. So the Shoemaker types out there keep testing for these inflammatory markers. And when they see somebody not getting better, they assume it's because of having mold, but they miss the point. If you have Lyme, it's probably Lyme triggering those to keep being active. So in Lyme disease, the best way to know if you have mold toxicity is to just measure do you have mold toxins in you? And that's using this urine test, okay? All right. So to answer your question, is glutathione the way to go? No, because glutathione is not even going to work on getting these mold toxins out because the liver using glutathione can't handle the mold toxins. What you want to be on are some binders. But even before you go that direction, I would get the testing done to see if you actually are having the problem, okay? All right. So if anyone wants to know more about which binders or how do you go about testing or why Shoemaker's approach is not one that I agree with, all that stuff. Let me just do a quick screen share here and I'll show you. All right, so take a look at my detoxification chapter here. And then take a look at my mold toxin illness article here, okay? And I talk about the Shoemaker, there's his name, Dr. Shoemaker, and the various testing that can be done, okay? All right. Thanks for the question, Catherine. Good luck to you. Hello, Marta. Can you discuss all the supplements that need to be taken away from antibiotics? Marta, the only supplements that need to be taken away from your antibiotics are your probiotics. As far as I'm concerned, everything else can be taken with them. And that's how I run my treatments, okay? The reason you want to take your probiotics with them is that your probiotics will be killed by the antibiotics if you take them directly at the same time, okay? All right. Good luck to you. Hello, Catherine. Let's see. In order to be diagnosed with mast cell activation syndrome, that's what MCAS stands for, everyone, there has to be a blood test, or is there another way? All right. So mast cell activation syndrome, everyone, let me just talk about that briefly. So mast cells are your allergy cells. That's what I'll call them. Inside mast cells are where histamines are made. And when something that we are allergic to lands on those mast cells, they will release these histamines, okay? All right, and then you get allergic reactions. Histamines give you runny nose, can sometimes give you hives. We now know that some of those histamines actually give you brain fog. These histamines can trigger asthma-type reactions. You get skin rashes, okay? All right, so that's classically what we thought mast cells did. We now know there's more to it than that. And that is that when you have mold toxins in you and you have infections, these things also turn on the mast cells so that they become more trigger happy and they release these histamines on a real regular basis, okay? So there are some tests you can do, however, they miss it a lot of times, and you've got to really look more. Often we have to diagnose it based on what your symptoms are. So do you have a lot of ongoing allergic reactions like I just described? Have you become more sensitive with allergic type symptoms to food, to things in your environment, okay? Those all can suggest mast cell activation. Headaches can suggest mast cell activation. So there is blood testing you can do, which would be like measurements of histamine or measurements of something called tryptase. There are measurements you can do, but they often will miss it because you have to be raging with histamine releases for them to be able to pick it up, and you often aren't. So we're left really doing this more based on what the clinical picture looks like, okay? All right. So there are things you can do to stabilize those mast cells too. Let me just do a quick screen share here. All right, so take a look at my immune system chapter here. And here's my article on mast cell activation. Okay. And so things that, again, that can cause it, toxins even can be involved, the bacteria I was telling you about, things you're allergic to, even drugs, and sometimes mold definitely can as well too, okay? And so blood tests that you can so the symptoms can be the fatigue and the tiredness, nasal congestion, itching, anxiety, depression, cognitive dysfunction is part of it, abdominal cramping. There's a whole host of symptoms that are part of it, okay? All right, so I outline like a whole approach for how you treat it here. In terms of the testing, where's my test section here? The testing that I would wind up doing would either be this I would do tryptase, histamine, and something called prostaglandin D2, and sometimes heparin, okay? You can do those, but they often miss it. So frequently I don't even bother. I just look at what the symptom complex is and decide to treat based on that, okay? All right. Thanks for that question, Catherine. Good luck. Hello, James. Hi, Dr. Ross. Thanks for doing this webinar. You're welcome. What is your opinion on getting amalgams taken out? I have about 10. Have your patients had much improvement after amalgam removal? Thanks. Thanks. So, James, in general, it kind of fits a comment I made earlier to Megan's question, which is there benefit in treating for heavy metals? So your amalgams, which would be your silver fillings, have mercury in them, okay? And over time, these amalgams can destabilize. They start to have mini breakdowns. And so when you chew, you actually develop, they've done filming of this, you develop these microscopic clouds of mercury vapor that hang out above the filling, and then you swallow that stuff down and you wind up getting heavy metal mercury in you, okay? But it's minuscule amounts, all right? You don't, when you have these amalgams, actually have blood flow into the amalgam, leaching out mercury that gets into your blood system. That doesn't happen. This is through this off-gassing vapors that happen above. The reality is, though, is that when I have people with heavy metal toxicity from mercury, for instance, I have found limited help by doing detoxification. Therefore, I have found limited help in most people getting your mercury fillings out. So the only way I would consider getting mercury fillings out is if you've been treating for Lyme for maybe a year, 9 months to a year, and you're not getting better, and your doctor goes in and does heavy metal testing to see, do you truly have a heavy metal problem? And if that comes back wildly elevated, in that kind of a situation, I might think about doing it. But for the most part, I just don't find much benefit by doing it. Okay. All right. Thanks for that question. All right. Let's see here. My throat's starting to get scratchy here. It's starting to tire. It's from all the talking I've been doing today with my patients and now here too. Hopefully it's going to hold up. All right. Hi, Mary. Let's see. Hello, Dr. Ross. Can you tell me how long you protect your patient? Oh, I'm sorry. Not how long. Can you tell me how you protect your patient's gut and microbiome with long-term antibiotics? All right. So, the microbiome is a complicated topic and they're complicated, and we're getting more and more understanding about it. So your microbiome, everyone, is the germ environment in your intestines. And that microbiome includes bacteria, viruses, parasites. These are non-infectious ones. These are ones that just cohabitate there, basically, all right? So to put this in context about how much is down there, it's a lot of stuff. If I've seen a study one time that said that 90% of the genetic material in our body is actually the DNA of these germs that live in our gut. 90% of our genetic material is what lives in our gut, okay? So that's pretty significant, all right? Now, we are not benign people. We just don't let these germs just kind of hang out there and party on all the time and eat the food we give them for any reason at all. We're getting something from it, okay? What we get from the microbiome are things that we are only really just beginning to scratch the surface on with research. What we do know, for instance, is that these bacterial germs that live down there are responsible for helping make neurotransmitters. They communicate with chemicals that direct our immune system. They remove toxins. They help keep bacteria from setting up and giving infections in the intestines. They remove things that we might be allergic to. They help with digestion of food. There's all kinds of things we're just starting to discover that they do. Okay, so it is important as best as we can to protect the microbiome. All right, now there's been some studies done that I saw, I think it was about a year or so ago. I saw a study that looked at what is the effect of 10 days of an antibiotic. And what we know, what the study I believe showed, and I just remember this off the top of my head, so I may not be 100% accurate, but it was something like 4 years after somebody had done just 10 days of antibiotics, they still did not have a return to normal of their gut microbiome. 10 days, that's just 10 days of antibiotics. And here in Lyme, we think about poisoning people with antibiotics for a year, 2 years, even longer. And I mean, I do it. I prescribe antibiotics that way for some of my patients too, okay? So when you're deciding if you're going to harm your microbiome, you have to do it for good reasons, all right? So it's a risk and benefit. So on the one hand, when we use antibiotics, there is a risk at injuring the microbiome. Okay? But that has to be compared against the risk of letting Lyme and its co-infection friends rage on and cause all kinds of problems, all right? So it's not a perfect world. Sometimes we have to risk injury to the microbiome to get the more difficult Lyme, Bartonella, babesia out of us so we can go about living our lives, okay? All right. So what I try to do as best as I can during treatment is to put bacteria back in. And so I like using a mixture of, so first of all, I like putting bacteria back in. So I like using both what are known as human microflora as well as a spore-forming bacteria as well too, okay? So human microflora would be strains of probiotics that have lactobacillus and bifidobacterium in them. And spore-forming probiotics would be things that have bacillus strains of probiotics in them. Bacillus strains of probiotics are ones that have come from the soil, actually, okay? Those soil or spore-forming probiotics develop a spore, which is a protective covering that means that they have an easier time getting through your stomach acid into the intestines, okay? It's controversial as to whether they actually inhabit your intestines or colonize your intestines, or what they may do is send out a lot of chemical signals that help promote the bacteria that live there to stay healthy and to grow more on their own, okay? In addition, I like putting the human microflora types in because they are the same kind that live in our intestines, and they're the ones that can populate your intestines, all right? So I like doing a mixture of both. So for instance, I might use a product called HMF Forte, which is human microflora that uses strains that have been proven to repopulate. It's a product by Genestra. I'll have people take about 2 pills, up to 4 pills one time a day. And then my spore-forming probiotic that I've been using is something called Corebiotic by Research Nutritionals. And I will do anywhere from 2 to 4 pills one time a day of that as well too. Okay, so those would kind of be some of the essential things I would do. All right, now, the other thing you can do is to try to feed and support your good bacteria, okay? And what works well to feed your good bacteria and to promote good bacteria is soluble fiber. All right, so soluble fiber can be good at that, right? So pectin found in apples and citrus can do that. Pectin is also found in oats. Another source of soluble fiber is avocado can do that, okay? Beans and legumes have some of them have soluble fiber. Usually what I have people do is you can Google, Dr. Google, go to Dr. Google, and you can Google sources of soluble fiber, and you will see these food lists that come up, okay? But if you can emphasize soluble fiber in your diet, that actually is a food source that supports the good bacteria in your gut as well too, okay? So the best you can do while you're on antibiotics is to try to keep the injury to a minimum by trying to repopulate and feed the good bacteria. That's the best you can do. But you're going to still have harm to it. There's no way around it. But you sometimes have to take that risk because you have to get the germs out. And some people, what is most effective would be the prescription antibiotics. Now, Buhner, as in Buhner herbs, I believe promotes the idea that you don't have to be worried about the gut microbiome with herbal antibiotics. I think he said that. I may be remembering that incorrectly, but I disagree. I have seen people get intestinal yeast overgrowth while using cat's claw or using Otoba bark. Okay, those are herbal antibiotics. So you still get some gut disturbance when you use your herbal antibiotics, gut microbiome disturbance, but it's probably not as great as what we get with the prescription antibiotics. Okay, all right. Good luck to you, Mary. Yeah. All right. Hello, LM. Let's see. I use a low dose of disulfiram. What do you suggest to use it with for excruciating pain in my knee and hip? So first of all, LM, I just want to raise an issue with you that you need to consider. Is the disulfiram causing that excruciating pain? Okay, so disulfiram, even at low doses, can cause neurologic injury. And about 15% of the time that people are on disulfiram, they do get neuropathy. Neuropathy can lead to numbness, but neuropathy injury can also lead to severe pain. And neurologic pain would have qualities of sharp stabbing, shooting, burning, piercing, or electric. So if this is neurologic pain, then you need to get off the disulfiram because there's a chance if you keep trying to push through it. What I'm seeing is maybe about 1 or 2% of people get into permanent nerve injury or a nerve injury that seems to be taking forever to reverse. So I don't get to ask you questions here, but if you have a type of nerve pain in these areas that is nerve pain, I would relook at why you're using that disulfiram. Okay. All right. All right. Then in terms of other things you can do for the pain, I usually like working with curcumin to lower cytokines. 500 milligram pill, 2 pills 3 times a day. Sometimes I will add to that by using quercetin, 250 milligrams, 2 pills 3 times a day. And sometimes I'll add to that by doing glutathione to lower cytokines. And that's that Trifortify product that I mentioned earlier tonight. And I would do a teaspoon of that 1 or 2 times a day. That's where I would start. Okay. All right. Good luck to you. Hello, Stanislaus. Let's see. Hi, Dr. Ross. What supplement, vitamins, herbs, etc. would you take for side effects of ciprofloxacin, please? And is it dangerous antibiotic if it's taken for 10 days only? Thanks a lot. Okay. So, I got to tell you, the fluoroquinolones, which is ciprofloxacin, and another fluoroquinolone, which is levaquin or levofloxacin, and then there's a third one called Avelox. I don't know if there's a fourth or fifth one now, but the fluoroquinolones have a problem, and that is the fluoroquinolones can sometimes lead to tendinitis, a lot of tendon pain and inflammation, and in addition, sometimes they can lead to rupture. Okay, now the chances of it happening, I think, is about 1%. It's not high, but the problem is that if you are one of the people that gets the neuropathy, occasionally it can become permanent, even after you stop taking it, all right? And it can even happen with a 10-day course. So I did used to use quite a bit of the fluoroquinolones in my practice for treating Bartonella. And I would say that 99% of the time, no one had problems. But I did get into a situation, even though I would warn people, there were still times when people did wind up having problems with it. And so nowadays, there's other choices we have. I tend to stay away from doing the fluoroquinolones because of that, okay? The thing that can sometimes work to prevent getting the problem, though, is high doses of magnesium. And you can do up to like about 600 milligrams a day of any kind of magnesium, whether it's magnesium citrate or magnesium sulfate. Some of my colleagues, to help prevent the tendon rupture, will have people on vitamin C. You might look at even like 5,000 or 6,000 milligrams a day on that. But I got to tell you that you can have some really bad outcomes if you are one of those 1% that you get a rupture or you get a permanent tendon pain. You're going to wish you hadn't done it. So my suggestion would be see if there are alternatives first. That's what I do with my patients. I only rarely do it anymore if we basically have exhausted every other option and my patient is clear in the idea that they know they could run into trouble by being on it, but it's their choice, basically. Okay? All right. Thanks for that question, Stanislaus. Hi, Averil. Hello from Philadelphia, Dr. Ross, and thank you for all that you do. You're welcome. My question is, what is the significance of having an HNK1 test result that shows CD57, CD8, CD57 are low? It's in a report from LabCorp. Thanks. Okay, so the CD57 is a specific type of white blood cell that can be low at least 80% of the time when somebody has chronic active Lyme. So it's a type of white blood cell that is suppressed, okay? The thing is, it's not necessarily specific for Lyme. So for instance, we know for sure, there's research that shows that having active HIV infection can cause it to be low, okay? And it is possible that some of these chronic viruses that live in all of us, I mean, most of us have some viruses that cohabitate with us, like HHV6 or cytomegalovirus. These are common in viruses that occur in living and healthy people and people with Lyme. These viruses might trigger CD57 too. So it's not specific. It is just, if it's low, it's a clue that you might have Lyme in you, but it doesn't prove you have Lyme in you, okay? So to interpret it, you want to look at what is known as the absolute count. So you're going to have CD57 percentages, but you want to look for the CD57 absolute number. And if the absolute number is at 150 or lower, that is what we consider low, okay? Now, it is not a useful test to repeat test. We thought when this test was first developed years ago, or we started using it in Lyme, that one of the things we would be able to do is follow it. And if somebody's Lyme was getting better, we expected less immune suppression. Therefore, we expected the CD57 would rise up as they got better, okay? But that doesn't always happen. The other thing is it literally oscillates plus or minus that number you get. Like if your number is 100, that actually there's actually a range of what the true number would be around what the test result is. So for instance, if the test result is 100, we know from laboratory studies on this that actually that 100 has a range that it actually could be. So the 100 they report actually could be anywhere from 130 down to 70. Okay, so that number. So if you wind up then repeat testing it and you get a number that's 120, and you suddenly think, my immune system's doing better. I'm now at 120 when you were at 100 before. It's still in the same relative range. It doesn't tell you you're getting any better. Okay. All right. The other thing we know is depends on the time of the day you do it. These things go up and down over a horizontal line. And although we used to think that people's levels would gradually rise as they got better, what we now know is they kind of oscillate up and down, this up and down. And then suddenly, if they are going to get better, it's almost right at the end of your treatment, they'll skyrocket up to the top. But not everyone's even gets better. It stays suppressed in people, even when we get them well. So it's not a predictable test that has, I don't even include doing it in my practice anymore. I don't think it has any definitive meaning and is useful in any way. All right. Thanks for that question. let's see here. Hello, Athena. Let's see. Hi, Dr. Ross. Thank you for your endless contributions. You're welcome. Why are antimicrobials not used for the growing spirochetes instead of antibiotics, i.e., less disruptive to the intestinal flora? Is this a viable option since Johns Hopkins has now demonstrated efficacy via Dr. Okay. So I think what you're asking is why don't we use herbal antimicrobials instead of prescription antibiotics? And so what I want to say to you is there is some of Dr. Zhang's work. Dr. Zhang has been looking at what herbal antibiotics might we use to treat growing and non-growing forms, okay? Some of his more recent work that he was part of shows, I think, that cryptolepis might be something that's useful. There's other ones too. What I want to caution you on is these are Petri dish experiments. And what works well in a Petri dish may not necessarily work well in a human. So for instance, I know Dr. Zhang has some work that shows that cryptolepis, for instance, which we traditionally use more to treat babesia, should be effective against Lyme. That is not my experience in clinical practice. I have not seen people's Lyme symptoms get better on cryptolepis. I have seen their babesia symptoms get better. So keep in mind that what we see in a laboratory test gives us some ideas to consider working with, but what happens in a lab is different than what happens in a living human being, okay? All right, so I just throw those comments out for you. So the herbs that I find helpful that can work as well as prescription antibiotics when it comes to Lyme germ, I like using a combination of otoba bark and cat's claw. I find those two herbs work 85 to 90% of the time at treating all forms of the germ. Not sure based on any studies whether they do anything for persisters, but they might. But what you can add to deal with persisters is oregano oil, which Zhang works says does work, and I've had benefit using that too, okay? Those work about 85 to 90% of the time, which equals about the chance of any 2 prescription antibiotics working for a person, for the Lyme germ, okay? For Bartonella, I like to work with sida, acuta, and Hutania. The success rate that I see in my practice is about 70 to 75% of people will have improvement on those 2 herbs. To make it even stronger to deal with the persister forms, I'm now adding oregano oil to that, okay? And that compares to doing prescription antibiotic regimens that work about 80 to 85%. So for Bartonella, I don't find that the herbals are equivalent to the prescriptions, but they're pretty good, okay? For babesia, I find that prescription babesia antimicrobials work about 80 to 85% of the time, while the herbal antimicrobials like cryptolepis work about 80% of the time. So I find a 5% difference for babesia, okay? All right. Thanks for that question, Athena. Or Athena, I should say. Sorry. All right, everyone, that's it. I've got 2 Basingis under here that are starting to move. I can hear them stirring down there. Halo, come here. Everyone wants to see what a halo looks like. All right, so this is one of my Basingis who is starting to stir, who's saying, hey, Marty, take us out, okay? Let's go home. So I got to get them out. So I would love to spend more time with you, but I think I got to get ready to go. So anyhow, I will have the video edited up here probably this evening. I'll spend time editing it. And my goal is to have it out to you somewhere between 9 and 9:30 a.m. tomorrow morning, okay? When you get that email, sign up for next week's webinar and also share it, okay? Share the work that we're doing here so others can get benefit as well too, all right? Good being here with everyone tonight, and I hope everyone has a good week. Good night.